Hi, this is Spencer, and in this video we're going to talk about ventilation. Ventilation is defined as the movement of air between the lungs and the atmosphere. It can be described in two different ways, by minute ventilation and alveolar ventilation. Minute ventilation is the total volume of gas entering the lungs per minute and is defined as tidal volume times respiratory rate. However, this is different than the volume of gas that reaches the alveoli themselves. Why is that? Mainly because of dead space. Can you think of a pathology that would decrease alveolar ventilation? That's right. Any obstruction that would limit aeration of the alveoli by increasing dead space, like cystic fibrosis or emphysema. One thing to remember is that obstructions limit alveolar ventilation. Alveolar ventilation is described as the tidal volume minus dead space volume times the respiratory rate. So what are the normal values for all those different parameters? So respiratory rate averages from about 12 to 20 breaths per minute. A normal tidal volume is around 500 milliliters per breath. And then dead space usually averages about 150 mils per breath. You'll notice the difference between the two in that alveolar ventilation takes into account dead space, whereas minute ventilation does not.